I am Dr. Prachi Gandhi, your gynecologist, your friend, and today I am going to discuss about cervical cancer. What is cervical cancer?
I don't know.
Cervical cancer is the cancer of the lower part of the uterus. You must be wondering why is it so important?
Yeah, please tell me.
It is important because it is the second leading cause of death among women.
That's bad.
It is also the most preventable and the most treatable form of cancer.
So, can you explain why is it caused?
It is caused by HPV virus, the human papilloma virus infection, which, if occurs for a longer period of time, can lead to cancerous changes in the cervix.
So, can it be prevented?
Yes, very important. It can be prevented by taking vaccination. The cervical cancer vaccine, that is the HPV vaccine, can be used to prevent the cancer.
That is very good. So, at what age should be taken?
The HPV vaccine should ideally be taken at 11 to 12 years of age. So I think you should all give the vaccination to your kids.
Oh, yeah, we should actually do it. So, this is the only cancer which can be prevented. That's good. And is there any role
I
of
think there is
hygiene?
one more cancer. The liver cancer which can be prevented by hepatitis B vaccine.
Okay.
Yeah.
So, hepatitis B vaccine, is it given to the children?
Yes. It is there in the routine vaccination program.
Okay, that's good. Is there any role of hygiene?
Yes. The role of hygiene becomes very important here since it is an infection.
Okay. So,
Coming to the symptoms of cervical cancer. The symptoms of cervical cancer can be foul smelling white discharge. It can also be frequent bleeding, heavy bleeding, and the bleeding between the menstrual cycle and bleeding after sexual intercourse. Sometimes there can be cancer with no symptoms at all.
okay. So, is there any test we can confirm or we can detect the cancer at an early stage?
Yes, we can do pap test to detect the cancer at an early stage. So I think it is very important for you all to visit your gynecologist to do the pap test, which can easily detect cancer at an earlier stage. And then, since it is the most treatable form of cancer as well, if detected early, this can be treated.
So, you all should visit gynecologist and get your pap test done.
At least every 3 years for all sexually active females.
So, is the pap test needed even after vaccination?
Very important point. Now, the HPV vaccination covers few strains of HPV virus which can cause cancer. But the cervical cancer can occur even with other strains of HPV viruses which is not included in the vaccine yet. So, vaccinated or not vaccinated, all sexually active women should visit the gynecologist for pap smear at least every 3 years.
Okay. And does the HPV affect men also?
Now, the HPV virus can affect both the females and the males. In males also it might lead to penile cancer and some other rare cancers, but the incidence of cancer in males is less as compared to in females. So, coming to the most important point, HPV vaccination both for the boys and the girls starting from very early age. One. Point number two, pap smear every 3 years. Guys, stay protected, stay smart. Protect yourself and your children. Thank you.